Time once again for a look at what's making headlines in the field of heart health. Joining me in studio today to talk about Convergence, a new surgical procedure, is cardiovascular and thoracic surgeon Dr. Edward Garrett. Dr. Garrett, thank you for joining us for Smart Medicine and our special segment, Heart of the Matter.
Thank you for having me, Joe.
All right, we're going to talk about Convergence today, which is used to treat atrial fibrillation. What is that? Please explain what atrial fibrillation is to our viewers and about this new procedure.
Atrial fibrillation is a common rhythm disorder of the heart in which the heart beats irregularly. And that first causes the cardiac output or the strength of the heart to decrease. It robs the heart of about 20% of its efficiency. So a lot of people feel tired, even short of breath. In addition, it predisposes to forming clots in the heart. And those clots can then break loose and cause a stroke or a loss of a limb or an emergency surgical procedure. So from both standpoints, it's a significant health risk. Convergence is a combination of a minimally invasive surgery with a minimally invasive cath lab procedure, which has a very excellent track record at curing atrial fibrillation.
And what are the patient benefits for Convergence?
Well, we've had about 90% success rate at curing atrial fibrillation, and so then those patients feel great. They're back in a regular rhythm. They don't have to take Coumadin, which is a fairly powerful blood thinner with a lot of side effects and risks, and they don't have the risk of having a stroke and that sort of thing. Recovery time is very short because it's minimally invasive. People go home within 3 days about. And then they're immediately back to their normal activities.
What patients qualify for this procedure?
Well, there are about 8 million people in the United States with atrial fibrillation, and because this is so minimally invasive, it applies to just about anyone of any age. The one group that we cannot treat are people who have had previous heart surgery because of the scar tissue around the heart, so that doesn't allow us to maneuver with our scope to get in proper position.
So, Dr. Garrett, if people want to learn more about this procedure, what would you suggest they do?
I think the easiest thing would be to call my nurse at 901-747-1262.
Very good. And you can also go online to smartmedicine.tv to learn more about this and all the other subjects we talk about here on Heart of the Matter. Thank you, Dr. Garrett, for joining us today.